Hi, everyone, and welcome to our first virtual program. I ask all of you to make sure that your phones are muted. Again, please make sure that your phones are on mute. If for some reason you do come off mute, I just ask that you please put yourself back on mute. So welcome everyone to our first virtual program, Staying Connected While Socially Distancing is important. In these challenging times, we are all navigating through uncertainty for ourselves, our loved ones, and our community. We are very thankful tonight to have Dr. Stacy Doumas with us, a psychiatrist with Hackensack Meridian's behavioral health team, and she'll be discussing how to deal with feelings of isolation, anxiety, and sadness to help us manage the best we can through social distancing at this time, since it's something that's new for all of us. So just a few items before we get started. All lines are muted, and please keep them on mute the length of the call. Again, if you're on a computer, please make sure that your volume's turned up so you can hear. And also, if you're on a computer and would like to submit a question for Dr. Doumas, you can use the chat feature, which is should be up on the top. And we are hoping for no technical issues, but if we do, please bear with us. This time, I'm going to turn it over to Dr. Doumas.
Thank you very much. If my video does not improve, I don't know if you're seeing what I'm seeing, but feel free to turn off my video on me if it does not improve. So we will jump right into the talk. For those of you who are on the phone only, I will try to describe what I have up on the screen so you can so you don't miss anything. So as Allison said, my name is Stacy Doumas, and I'm the Residency Program Director and Vice Chair of Education for the Department of Psychiatry at Jersey Shore University Medical Center. And we're going to talk today about COVID-19 and our impact on our health and our mental health. We're going to discuss how staying connected while social distancing can really be beneficial to us and how we can do that, and how if we are having feelings of isolation, anxiety, or depression, how we can deal with those feelings and some coping strategies to cope with stress. So the first thing I want to ask is the question, am I normal? And the thing I want to say to answer that is if you are having some sort of stress reaction in the past couple months as stores and everything were shut down, kids are staying home from school, people might have lost jobs. Everyone reacts differently to stressful situations. So yes, you are normal. Regardless of what reaction you're having, it's probably a normal reaction. Doesn't always mean it's the healthiest of reactions, so that's what we're going to talk a little bit about today. But some stress reactions include like fear and worry about your health or the health of loved ones, changes in sleep, changes in eating. Are you eating a lot more than previously or a lot less? Difficulty sleeping, that is the biggest one I've heard from colleagues at the hospital as well as patients. Or trouble concentrating, like where you feel like you're jumping around from activity to activity and can't focus on any one thing. Worsening of chronic health problems, or increased use of alcohol, tobacco, or other drugs to cope. Sales of alcohol have increased dramatically during this crisis. So these are kind of normal reactions to stress, but as we all know, the last couple there, the increased use of alcohol, drugs, and tobacco are not necessarily healthy reactions. So we want to talk a little bit about how we can be helpful during this time. So these are some of the worries. On this slide, we do have a picture of a child who's worried. These are some of the main worries that I'm hearing about. So let's see if you can relate to any of these. Getting sick yourself or getting a loved one sick. That's a big one for all of us who work in the hospital or who have relatives who might be older. Losing your job, finances, children and virtual or online schooling, grief or suffering alone. Are we worried about how long COVID-19 is going to last? Is it going to come in waves? Is it not going to go away before the fall? There's a lot of uncertainty with those questions. Are you worried about feeling restless while social distancing and like what's okay and what's not as we social distance? Do you worry about a vaccine? Because I know I sure do. When it's coming, if it's coming. And do you worry about when things will get back to normal? These are all very normal worries at this time, and they're things that are on all of our minds. So during a stressful event, there's a lot of things that happen in the body. We're just going to talk about a couple of them. In your brain, there's an increase in cortisol, an increase in the in norepinephrine, and there's a decrease in serotonin. Serotonin is what we kind of talk about as the happy hormone. It makes people, when you have appropriate levels of serotonin, it usually leads to greater happiness, more pleasure. And with these changes that I just discussed in the brain, people might be more angry right now, more depressed, and more anxious. So one of the things we're going to talk about in a minute, we're going to talk about how bad that can get, but then we're going to talk about how we can protect our bodies and how we can protect our minds during this difficult time. So how does isolation impact our health? Now, this can be any isolation. For us, for many of us, this is probably the first time for many of us that we've been isolated before. But isolation can impact sleep, which I'll show you, which is obviously very essential to us. It can lead to anxiety and depression. And in people, especially older people, it can lead to cognitive decline, so memory problems. And believe it or not, isolation can also impact your cardiovascular health, so your heart health can be impacted, and your immune system. And obviously, none of us want to impact our immune system at this time, putting us more at risk for getting coronavirus. So if isolation leads to mental health issues, the most common issues we would see would be depression or anxiety. Depression would be seen with symptoms of sadness, feeling down, depressed. In kids, very often we don't see them saying they're sad, but we see irritability, maybe withdrawal. We might see poor energy, poor concentration, changes in appetite or sleep. For some people, that's that they just want to sleep all day, and when they're up, they're eating while they're up, overeating. For other people, they might not be able to sleep or eat. Some of the real concerning things we look for are feelings of worthlessness, helplessness, feeling guilty even when there's nothing to feel guilty about, and being less interested in things that used to, be pleasurable for someone. And obviously, we get very concerned if someone's having thoughts of self-harm. And depression can also lead to memory loss in people who are elderly. So remember here now, isolation can lead to cognitive decline and depression can lead to cognitive decline. So people who are older are really at risk during a period like this, and they're the ones who need to isolate the most because they're most at risk of getting COVID as well. What anxiety looks like right now is people being kind of restless and keyed up, maybe irritable, unable to relax, jumping kind of from activity to activity with kind of anxious thoughts in their head all the time. Maybe some physical symptoms and trouble falling asleep because you're kind of processing these things in your mind at night, or you wake up kind of in a panic over them. Those are some of the symptoms of anxiety I would look for. Obviously, if you're a frontline worker, EMS, healthcare worker, and you're having symptoms that are directly related to either taking care of people or with COVID or watching people, die, that might be more in the post-traumatic stress disorder realm, but still an anxiety disorder nonetheless. So if anybody around us over this period of time is reaching this point of symptomatology where we think it's causing impairment or that they're having thoughts of self-harm, that's when we want to start thinking about reaching out for help or that referrals might be needed for mental health treatment. And I'll give you those resources at the end. But the main goal here is to avoid getting to the point of feeling so anxious or depressed. And I mentioned sleep was a problem of isolation and anxiety right now. So this is what's so bad about lack of sleep. There is a person trying to sleep under their pillow if you can't see the slides. It can lead to increased blood pressure, heart failure, stroke, obesity, and diabetes. So that's a lot of things that most people didn't know had anything to do with lack of sleep. And as we can all imagine, it could lead to depression or irritability, poor concentration. Anybody who's stayed up with babies and stuff knows that they're feeling kind of out of it. And difficulty concentrating. And sleep can also lead to a decreased sex drive. So one of the first things we want to really look at in taking care of our bodies right now, and this holds true really for everybody across the board, all the way from children through adults and through older adults, is that you want to get on a good sleep schedule. And sometimes it's very hard to fall asleep at night. So you want to make sure you're setting the clock and getting up at the same time at least, because that'll at least help reset it. If you have trouble falling asleep, you don't want to sleep till 2 o'clock the next afternoon. I know the teenagers are all trying to get away with this right now. You want to avoid napping unless absolutely necessary. And in that case, short power naps. And it's really helpful to get sunlight every morning. 20 minutes is what's recommended. But if you're someone who has the mobility to go outside, going outside and incorporating exercise with that is wonderful. If you can't, opening the blinds, the windows, putting yourself in a seat near the window, that's great too. And good sleep hygiene. What that means is just, maybe not watching TV in bed or being on your phone right before bedtime, having, an appropriate bedtime routine that's going to make you more likely to be tired at the time you're planning on going to bed. And if those things aren't helpful, going in the direction of deep breathing, mindfulness, which we'll talk about in a minute, those things can be helpful. And then if that's really not enough is when you look toward reaching out to your primary care doctor and considering something like maybe a supplement like melatonin or something that, that would work for you and your health conditions that your physician recommends. The other thing that is so important to maintaining your health during this stressful time is keeping a routine. And for some people who are still going to work, that's a little bit easier. But for people who are either working from home or not working and have kids home, it's tough to keep a routine sometimes. So some of the recommendations are to really make sure you get up and get dressed every day. I love all the jokes I see online about, oops, I've got to change out of my daytime pajamas at 9 p.m. and put on my nighttime pajamas. But it really does help to get up and get dressed every day. Eat meals that are at least somewhat healthy. This is not necessarily going to be the time where you start eating, 100% healthy if it wasn't something you did before, but you also don't want to fall into a lot of negative habits right now. So, try to eat your standard meals pretty healthy with some treats here and there, especially if you're in a lot of stressful situations. A little bit of treats are okay, but you want to have a base of healthy meals. Staying hydrated, getting outdoors. We just talked about how that sunlight is really important, but you also want to get outdoors and get some exercise, whether that's going for a walk, whether that's, a bike ride, whatever you can do and are capable of. It's helpful to do it every single day, but at least several times a week. And if you're someone who has mobility issues or needs to stay inside, even exercising from a chair or on the couch or any amount of exercise helps and is better than nothing. So you really want to shoot for 30 minutes a day, but if you can do anything, it's definitely helpful. You want to make sure you're taking your medications, taking your vitamins. This is the time to make sure you're taking care of those underlying health conditions. You want to make sure that you're staying informed about coronavirus, but I would also say not too informed. You want to limit things that are going to lead you to feel anxious and panicky. So maybe, I know in the beginning people were watching the news, 24/7, and you kind of want to avoid that. I think it's a little bit easier to do now than it was a month ago. Also, maybe limiting screen time in general, remembering those old hobbies that you might have had, or if you were a sewer in the past, putting that toward good use and making masks now. But picking up a book, playing a game of cards or playing a game with children, but something that's not, on a screen. And obviously limiting alcohol and avoiding drugs and nicotine. And it's especially important to avoid things that are going to impair your judgment around this virus and put you in a worse respiratory state, as smoking would do, and make you more susceptible to complications if you were to get the virus. We also need to protect our minds because that's the biggest issue sometimes. Like some people are like, okay, I'm taking care of my body, I'm doing okay with that, but I feel like I'm going crazy here. And they just feel like the stress of the situation, the stress of having their whole families in the house 24/7 can really start to wear on people. And so this picture that I have up is a picture of a brain lifting weights. So we're going to talk about protecting our mind. Number one is being in the moment, and we're going to talk a little bit about mindfulness. Number two would be controlling what you can and accepting what you can't. And the third way of kind of protecting our minds, that something else we can do, is cultivating calm. So we'll talk about each of these a little bit. So being in the moment, I talked about mindfulness. So what is mindfulness? And the pictures I have up here for anybody who can't see it, it's some pictures that would be our pictures that we would think of with Buddhist monks and those kind of Zen pictures of mindfulness. But mindfulness, it's not necessarily what you are doing, it's how you are doing it. When I am mindful, I have attentional control. And on this page, I have pictures of a dancer, a volleyball player, football players, and swimmers in the moment while they are engaging in their sports. And they are truly mindful of what they are doing. I am focused on the present moment. I am not thinking about the past or the future. This slide got a little wonky on me, but you can see, anybody who's looking at it can see three musicians who are also in the moment of what they are doing. The other slides, the other pictures that are missing from this slide are people who are eating and at a point where they are truly like enjoying the meal that they are eating. So mindful eating is something that, oops, they're popping in for me. There's our hamburger and our cup of tea. So mindfulness is paying attention in a particular way. It's on purpose. I choose to pay attention to something. I am in control of my mind. Mindfulness is in the moment. I am paying attention to right now, not the past or the future. I am alive in this moment. And mindfulness is without judgment. I'm not thinking about this moment as good or bad, which dramatically reduces any anger you might be feeling, and it improves your ability to understand and problem solve. So one of the major things that we can do as we feel, frustrated and out of control right now is the things that we are doing right now, we can be mindful doing them. So whether you are helping a child on virtual school, whether you are my big thing I spend a lot of time right now doing is playing Barbies with my daughter. And sometimes my mind does want to wander. I want to sneak and pick up that phone for a second, when it's 4 hours into the Barbie session for the Saturday. But it's being mindful at that time and, being there in the moment and not having that judgment. What else can I control? And these are skills that we can use to cope with stress. And we're going to talk about each of them. We have grieve and accept, shifting gears, redefining, focusing, and setting goals. So grieving and acceptance, this is thinking about that so much is out of our hands right now. There's so much that we cannot control out there, and there's so much uncertainty, so many I don't knows about the future. Like, I don't know when, the Grove in Shrewsbury is going to open. That's the shopping mall that I like to go to around us. I don't know, when we're going to be allowed to go to beaches again. So much uncertainty. So grieving allows us to feel the sadness about the fact that our day-to-day life has temporarily changed. And then accepting will allow us to accept that life has changed. So we're going to grieve it, we're going to feel the sadness, and then we're going to have to accept it. So grieving and acceptance helps us move toward healing at this time. Shifting gears and redefining. Shifting gears means moving negative statements into statements that allow for balance. So we're going to shift statements such as, this is never going to end. And I know some days feel like that, to, I'm not sure when it's going to end, but I'm doing everything I can, and I will get through this to the best of my abilities. And redefining means, what does it mean to have a good day right now? I know as I see some of the jokes and stuff, a good day means that you did get dressed. And that, that kids did well on school without a tantrum or without an email from the teacher that work wasn't handed in. So we're redefining what it means to have a good day. And we never would have even considered those things defining a good day 2 months ago. Like, we always got dressed. We never got emails from the teacher about work not being done from the school day. So we redefine what it means to have a good day. The next one is to set goals and refocus. So set goals that are achievable within the new circumstances in life. I know for a lot of people, these goals are cooking or baking, learning new recipes, gardening, maybe exercising and walking, doing something with children that might include a game or something like that. We have been very creative in my house at making up new games with challenges. Challenges is our big thing right now. I've tasted more things I've never wanted to taste in my life recently. And refocusing on what we do have control over and what we can change. So think about that. Really think about that at this time. What are some goals you have for yourself during this time? And what are some things that you have control over? And I think in the beginning, some of us set goals like, I'm going to clean out every closet in my house and I'm going to, do all the spring cleaning and stuff. Those goals might be a little excessive. But some more basic goals, maybe if you take the small steps toward the more basic goals, you might get to some of the larger ones over time. And really focus on the things that you have control over. The next one is cultivating calm. And so we want to do this. Also will help us with sleep. And I've got a picture up here of a boat dock near my house with one of my favorite biking buddies. One of my sons is biking down it. So it definitely is a good picture of calm. We want to reduce exposure to news, especially before bedtime. We want to do things that help us feel calm. If anybody wants to try things like deep abdominal breathing or muscle relaxation, there's great apps online. Headspace, I think, is one of them. But there's great apps that will, take you through how to really relax yourself through breathing and through muscle relaxation. Some people like to do it with music, walking, drawing, writing. You really need to, taking a nice hot bath or a hot shower. You really need to think about what relaxes you and plan it into your routine. Plan to do it so you can feel calm and relaxed. And it's also really helpful if you have children around you who might be getting upset sometimes, to do things to help relax them, to know what helps with them too. Excuse me. I'm not sure I have a drink around here. Okay. The next one is that we all know at this time that we have to mind the gap. I think this is from a picture from London where that's where they say at all the subways. I think they have a different name for them. But we need to socially distance. But socially distancing means physical distancing. It does not being disconnected to one another. In fact, it's more important than ever not to disconnect from one another. Excuse me. In fact, one of the main things in order to be well at this time is to really try to reduce loneliness. We have to do this in ourselves, and we have to do this in our friends and family. So we need to do this by connecting in any creative ways we can come up with. I know many people are doing this through the Zoom app and having Zoom family gatherings. I know one close friend of mine managed to do a Zoom family gathering for Easter, one with cousins in Long Island and another with cousins in South Africa. So she would never have done that without this current crisis. Wouldn't have been able to do it so far away. So we want to help others cope by reaching out to them as well and checking in with children, siblings, cousins, parents. So make that phone call, set up that Zoom meeting. If someone hasn't set up a Zoom meeting or done one yet, it is so easy to download the Zoom app on your phone, join and set up meetings and connect with people. And so many older people would also be able to do it because it's really pretty simple. But social connection boosts well-being, both theirs and yours, and it can reduce depression. And you want to really look for moments of humor so you can laugh with loved ones. And even if it's planned moments of humor, one of the things that's become something to do with my children and their grandmother is they tell each other jokes. And it started as something to try to get the Zoom meetings going, and now it's something that they call each other on the phone and do too. So you really want to find moments of humor, but you want to keep those connections. And I know as we start to decrease some of the social distancing, there's questions about like what's okay and what's not okay to do. And I think that that's going to be easier for people who are really at risk of COVID. I think they have to just be careful for longer and stay more distant, stay away from people who could put them at risk of getting sick, which means they're going to have to use phone calls, Zoom meetings, and other ways of staying connected with people. For people who are obviously less at risk, they might be able to, to be able to change the restrictions a little bit as the rules change in our state. But I guess there will be more to come on that. I know I've seen some creative ways that people have been social distancing, talking to neighbors across the street or across driveways and stuff, because everybody's really looking for that social connection. We are social beings. I think it's also very important to have some self-compassion at this time. We have to look for opportunities to be patient and kind to ourselves and really celebrate success each and every day, even if it's the tiniest success. Also looking for things to be grateful for and looking for silver linings in this situation. I know I have said many times that the time I have now with children that I hadn't had before because we were running around to so many activities is definitely a silver lining. We also want to really look for inspiration. I have seen so many people doing so many wonderful things that have really inspired me. And I think we want to be kind, forgive, understand that if other people are feeling stressed, anxious, depressed, etc., they might not kind of be on their best behavior. So we do want to be kind, forgive, appreciate. And if we're in a position to, we want to look for ways of helping other people. Maybe that's donating to a food bank or making masks or signs for a hospital, reaching out to someone we haven't spoken to in a while, whatever that might be. If anyone has children, there's going to be, I have some tips for children here. They're going to want a lot of attention. Understand that children are definitely looking. Maybe they're getting a little bit more needy, a little bit more tantrumy. That's to be expected. So they're going to want that attention. You want to be loving and warm, but still kind of authoritative with them. But really ask them about their feelings. Try to express empathy for what they're going through. You want to try to help them stay connected because they're having a lot that they have to grieve right now and that they've lost because of missing the school year. You want to have honest conversations with them about COVID, but that are developmentally appropriate. Obviously, a 4-year-old can't understand the same things as a 16-year-old. You want to help them with school. And I do have a picture up here. I somehow caught one in the basement playing Fortnite at the same time. He was on ELA this morning. So sometimes they will need a little bit of help with that. And you want to encourage as many off-screen activities and limiting the video games as possible. And encourage creativity. You want to encourage them to get outside, get some fresh air. I do have a picture up here of the back of one of my other children. They made themselves a field day the other day, and they were doing they were jumping over soccer nets with chair cushions in their hands and timing themselves. So really encouraging that creative play. And they do it so well. Sometimes the siblings are really learning to get along with each other because they don't have their other play dates and such right now. But they're going to definitely require a lot of love and guidance from their parents right now. Some tips for older adults. It's very important for them to keep in contact with people so they don't feel isolated, disconnected right now. And really sticking to those routines is important because if they don't have maybe children to take care of like someone else or a job to go to, if they don't get up every day and open those blinds and go for a walk and put clothes on, it's going to be easy to fall into a negative state. And they have to not be afraid to ask for help. And that is a picture of my mom and I on a Zoom one day. So those are some tips for older adults. And so kind of in conclusion here, how do we cope with COVID stress? Take care of our bodies and our minds, stay connected, help others, and reach out for help if you need it. And the picture I have up here is a rock that says never quit that my son made for a rock garden assignment for school about 2 weeks ago. It was one of his assignments to do over the weekend. And here are some resources through Hackensack Meridian Behavioral Health. I hope everybody has this slide. I think they can put some of the numbers hopefully in the chat for people who are just, if you're on the phone, I guess you don't see the chat either. But so Jersey Shore University Medical Center, their outpatient behavioral health phone number, if anybody wants to make an appointment, is 732-643-4400. And if you just go to our website, hackensackmeridianhealth.org, you go to the behavioral health tab, which is under the services tab. We have a list of all the crisis hotlines, our new urgent care with behavioral health in Neptune, New Jersey, which has walk-in services 7 days a week. We also have on-demand telemedicine visits. That's all there. And under integrative health and medicine, that's a different services tab. We have some great services as well, and we have a whole library of articles at Health U Online. So you can check out all of those services at hackensackmeridianhealth.org. So thank you very much. I'll leave that last page up there for anybody who wants to get down those numbers. And that's the end of my talk, but if there's any questions, Allison, I'm available to take them.
Okay, perfect. Do you have a question? So is it okay to socialize while wearing masks and seated more than 6 feet apart, like parking lot meetups and driveway hangouts? I know you mentioned that as, some unique things that people are doing. And at what point does mental health outweigh the risk of infection?
I think that is a great question, and I'm not sure that there's an exact right answer on that. If you ask an infectious disease expert, you might get a different answer than I would give. I think mental health is, absolutely important. I do think it matters who you are. As I said, if you're an older adult with chronic medical conditions, especially like an older adult with asthma, you might not want to get too close to too many people. Now, I do think it might be appropriate to, sit on your driveway and socialize with the person up, across the next driveway over. I do think it gets I think you have to be careful. I think it's fine as long as there's, really appropriate distance. I do know that the children, you tell them to stay away from each other and 6 feet quickly becomes, 4 feet, 3 feet, 2 feet. So I think that you have to really, truly maintain the distances recommended, which I know is currently 6 feet. And I think you have to be careful you don't put yourself in situations where you're going to need to break that social distancing or get too close to people. For example, if you drive somewhere to go meet people and then you need to use the restroom, you don't want to go in that person's house to use their bathroom. So I do know that that's why I have not taken my children on a drive-by of my mother's house, because if I take children to her house and then we need to use a bathroom, I've now taken them somewhere where I can't provide for that service. So we haven't done that. So I do think you have to really think ahead for any possible things that can happen before you make those choices.
Okay, and do you have any tips on how to deal with people that may not be taking social distancing seriously or the virus seriously?
I have to say, I think that it's very frustrating. So I can imagine that people feel, a strong sense of frustration, especially if they're in one of those groups of people who are at risk. I think that you can really have to worry most about yourself. So I don't think I'm amazed to see, if I go out for a walk, how many people are close to one another, walking with people that I know are not from their family, right next to them without masks on. Like, I'm pretty amazed to see how many people don't take it seriously. But I don't think we can go up to all of those people and tell them. I think we just have to depend upon the lawmakers to really, I know in Massachusetts, they just implemented a law saying there's going to be $1,000 fine if you don't wear a mask. So I think we have to depend upon the lawmakers and stuff to really put those rules in place. And I think that we have to focus on protecting ourselves. So if you're one of those people who is at risk or who wants to make sure that you're practicing appropriately, I think you have to make sure you wear the mask and that you stay away from other people, and kind of, just, kind of practice the appropriate guidelines yourself. I don't think we can go preaching to to everyone else. I think that we just, we have to just be good role models and model that behavior for our own children and families.
Perfect. And the final question, do you have any suggestions for people who work in healthcare to come back home and connect with their family? Possibly suggestions on disinfecting themselves before approaching them?
Well, one of my peers in internal medicine jokes that all of them talk about that you strip in the garage, put your clothes in a bag to carry it to the washing machine, and run to the shower. I'm not quite sure whether they're joking or not, but I do think that there is, and that they leave their shoes in the car or leave their shoes outside. So I think that people who are on the front lines like that are very, very concerned about, I think that they really need to make sure that they change their clothes. If they're actually right near patients who have COVID, need to be, showering immediately upon returning home. I know that one peer I talked to lives with an at-risk elderly person, and that person, they both wear masks in the home because of the fear of transmitting it. Now, I'm not sure that's necessary, but I do know that most healthcare providers are taking care to protect their family members by disinfecting themselves, whether it's changing their clothes, showering. And I think most of them make the decision based upon how close they are to patients. So if they're in an administrative role at the hospital and not necessarily near patients, they might not be, doing something as severe as if they're, right in there in the patient rooms that have COVID. But everybody in the healthcare field that I know is extremely concerned about protecting themselves and their family.
All right. Well, thank you so much, Dr. Doumas. This was very helpful and informative. And I thank everyone on the computer or phones. Thank you so much for joining us. Please watch your email for an evaluation of the program. We'd love to hear what you thought. And we could also send out that resource page if you registered with an email as well. Just so you know, coming up tomorrow and May 11th at 2 different times, we have another webinar, how to help kids with coronavirus fears. So you can check out our website or call to register for that program. And then there will definitely be additional virtual programs being planned, so keep your eye out. Again, thank you so much, Dr. Doumas, and thank you everyone for joining us. Please enjoy the rest of your night and stay safe.
Thanks. Bye.